Ladies and gentlemen, I'm Chongliang Xu, Vice Minister of the Ministry of the Health and Welfare. It's my great pleasure to give the opening address of the Global Healthcare Unity Summit. Taiwan government has been promoting new southbound policy since 2016, which calls for developing comprehensive, mutually beneficial relations with countries in the Association of Southeast Asia Nations and South Asia, Australia, and New Zealand. India is always listed a key country in all areas. This year, COVID-19 wreaked havoc worldwide. What we suffer are not just life's rules, but also in all dimensions. Taiwan is one of the few countries which have been able to contain the spread of the COVID-19 quite effectively. Taiwan, only 130 kilometers from mainland China, not only has numerous visitors from China, but also have many people working and studying in China. Even Johns Hopkins University initially predicted that Taiwan would be one of the hardest hit countries in the world. However, Taiwan's aggressive measures have paid off and successfully kept the COVID-19 at bay. Here I'm sharing today is about how Taiwan fights COVID-19. As of now, the global confirmed cases are smashing through 30 million. In Taiwan, we have 509 confirmed cases and 7 deaths. This success is not coincidence. The Taiwanese government integrated data from the national healthcare system, immigration, and customs authorities to aid in the identification and the response to the virus. Government's efforts are all coordinated through the National Health Command Center of the Taiwan CDC, established to aid in disaster management for epidemics following the 2003 SARS outbreak. The 2003 SARS outbreak led to the loss of thousands of lives, which makes our government and the people on high alert at the early stage. Last December, when we heard of the contagious new respiratory illness began to appear in China, we started preventive measures. We established the Central Epidemic Command Center, implemented border controls, and introduced the mandatory quarantine. After January 21st, when we had the first infected case in Taiwan, we started a strict investigation to track the travel and the contact history of every patient, which helps contain the community spread. Taiwan not only enacted border control procedure, but also enacted relief measures to counter the economic impact. After its setup, Taiwan government also hosted press conference to report the situation to the public and use social media, YouTube, Line, news channels to emphasize the importance of sanitary and prevention methods of COVID-19, to educate the public honestly and transparently with public once a day. The government had implemented a ban on exporting face masks in order to ensure an adequate supply for citizens after the first case of COVID-19 was discovered in Taiwan within 3 days. Sale of masks was also strictly controlled in order to make sure every individual had access to them, without the people being able to buy and hold masks for private use. Also, we began a massive increase of production of medical masks, as well as sanitizing alcohol. In addition, we started rationing face masks and quickly established a national team for medical mask production. In addition to the public health professionals led by Health Minister, all our citizens have done their part, such as to wear face mask, monitor body temperature, keep social distance, and maintain hand hygiene. This is a partnership we call Team Taiwan. COVID-19 is a global level disaster which requires a joint efforts of all countries. Despite the lack of the official diplomatic ties between Taiwan and India, both countries set up representative office in each other's respective capitals in 1995. Since then, we have engaged in dynamic, ongoing communication on many levels. For example, in this epidemic, Taiwan provided surgical masks to India in support of frontline medical personnel. Taiwan's researchers at Academia Sinica announced they have synthesized over 100 milligrams of the remdesivir. It took the team, which includes 2 members from India. Also, National Cheng Kung University Hospital, Taiwan have been sharing experience related to COVID-19 information, including testing methods, treatments, approaches to containing infection, and measures concerning masks. Over 10,000 medical personnel in India benefited from these webinars. Taiwan has one of the world's top healthcare systems and strong research capabilities. Although Taiwan is unfairly excluded from the WHO and the UN, we are still willing to share and collaborate with the public and the international bodies. Over the past months, we established a national team. Now, we must take part in a global campaign and work together with other countries to set up a zone defense and comprehensively prevent the spread of this virus. No one can isolate a friend who genuinely wants to help. Out of the humanitarian concern, Taiwan cannot stand by while countries are in dire need of assistance to stop the spread of the virus. We are willing to provide assistance to the international community in 3 areas: face masks, pharmaceuticals, and the technologies. Taiwan will actively bolster our cooperation with other countries to prevent the spread of the COVID-19. In times of crisis, countries around the globe must unite, show solidarity, provide mutual assistance, and work together to fight the coronavirus. Taiwan is willing to exert its influence in this battle and join hands with the international communities so that we can overcome this challenge together. Taiwan can help, and Taiwan is helping. Here, I wish everyone good health and stay safe. Thank you so much.